Barabara kabisa mpenzi mtazamaji, karibu tena kwenye awamu nyingine ya kipindi cha Matukio Mtambuko, ambapo nitakuwa na kufahamisha baadhi ya taarifa ambazo tumepokea katika chumba chetu cha habari. Lakini kwanza kabisa, muungano wa kutetea haki za wahudumu wa afya nchini KMPDU unatarajiwa kutoa taarifa kwa wanahabari leo kuhusiana na masuala yanayohusu matabibu. Baadhi ya wahudumu wa afya wamekuwa wakilalamikia ukosefu wa vifaa vya kujikinga wanapowahudumia wagonjwa wa virusi vya corona. Aidha, wanatarajiwa kufafanua zaidi iwapo lalama zao zimeshughulikiwa. Swala la iwapo kaunti zina uwezo wa kustahimili idadi kubwa ya wagonjwa wa corona pia inatarajiwa kuzungumziwa katika kikao hiki. Lakini kwa sasa labda tupate picha za moja kwa moja, na kama jinsi ambavyo unatazama pale tayari wameshaanza kuzungumza. Hebu tusikize kile ambacho kinaendelea.
Our rallying call has always been treat healthcare in a standard way, so that whether you are in Mandera or you are in Busia, the standards are the same. And before I welcome the SG, the other thing I want to say is that with the directive of the President to set up a 300-bed capacity facility, we have to remember one thing, that capacity, the 300-bed capacity facility, is not just the building, it's not just the beds, it slightly goes beyond that to take care of the workers who will be working there. And that's why our position is, as you set up those facilities, make sure you have matching numbers of healthcare workers who are going to work there. So make sure you have doctors there, make sure you have nurses there, make sure you have lab technicians there across all cadres. We don't want a case where you have a building, you have a facility, but we don't have people to work there. And lastly, Waswahili husema ahadi ni deni. There was a directive by the President to give healthcare workers welfare package. We've seen sections of it being done in one way or the other, but more importantly, we've not seen the same reflecting in their pay slips. I want to thank Machako's government, for example, for going out of their way to at least give a package to appreciate and cushion the healthcare workers working in that county. But nationally, we've not seen this being replicated, and therefore all the concerned authorities, tafadhali, ahadi ni deni. With those few remarks, may I welcome the SG to give the official position of the union. Thank you.
Good morning. Thank you once again for coming to our weekly briefings and for the support that you have shown us as a union during this COVID-19 pandemic. We are grateful, and we look forward to keep highlighting the issues and the status of preparedness in the country as a union in the healthcare sector. So first and foremost, would like to thank the President for his leadership and direction during the COVID-19 pandemic. To notice that he has continuously appreciated and sought counsel from healthcare professionals. And beyond that, we equally thank him for recognizing the role of healthcare professionals by awarding them with the Uzalendo Award last week on 1st of June during the Madaraka Day celebrations. We say thank you for that, and as healthcare professionals in this country, we shall continue providing our services and counsel whenever required for the greater good of our country. We'd also like to empathize with Kenyans for the tough times that we are all facing. We are aware and we acknowledge the survey on coronavirus conducted by Infotrack and released yesterday. And it highlighted several issues, but more importantly is that majority of Kenyans are worried about the capacity of our country to deal with the COVID-19 pandemic, and that the three key issues for Kenyans were food security, poverty and unemployment, and access to health care. And we all know that the mitigation measures some put in place have actually had an impact on access to health care. So it is important that as a country we put forth a clear strategy to ensure that there is continued access to healthcare services even with curfews in place, and that no one faces brutality by the police and the authorities that have been mandated to actually ensure that we are all safe. And we thank Kenyans for their support, acknowledgement, and actually ranking healthcare workers top in their response and role and the good job done in COVID-19. In fact, this rating has actually increased from 58% in April to now 77% in June. So we thank you, Kenyans, and we shall stand by you by ensuring that we are available to serve you whenever required. We note and acknowledge and welcome the directive by the President during his 8th presidential address, and actually the observation that our counties are not yet prepared to handle a surge in cases. The past 1 week, we have all seen the triple digits in the daily rise in cases, and we anticipate that in the next few days we shall actually hit the 200 mark, going by how the figures have been going. So that means that for this month, we are likely to see an exponential increase in cases. That said, we actually welcome even the decision to hold a summit between the two levels of government to ensure that the directive to set up 300-bed isolation facilities in each county is achieved. With that, we equally as KMPDU state that the infrastructure setup is important, but more important is the human resource function and the human resources required to run these facilities. If these facilities are set up in our current scenario, where the healthcare are in their current numbers, they are not yet enough, then we will still not be able to achieve the desired outcome. We have the projections that each 300-bed facility will require in terms of human resources for health. 636 doctors, 1,000 nurses, 360 clinical officers, 572 laboratory personnel, among other personnel, including porters, morticians, cleaners. And so we appeal to the summit as it convenes to consider further budgetary allocations for the HRH component. And we acknowledge that so far 8,000 have been hired, but these projections that we have to ensure that there is quality and efficient service delivery in the isolation facilities is an additional 5,000. And due to this, and noting that there's a directive to employ, we know that there have been interviews conducted by the Public Service Commission. This directive has taken a month. We note the continuous conflict between the two levels of government with regards to handling human resources for health, and noting that we're in a devolved system of governance where health is actually a shared function. As KMPDU, we recommend, and noting that we are having the discussion and the direction of constitutional amendments that the Health Service Commission be considered as one of the constitutional amendments. We presented this to the BBI Steering Committee, and we also appealed to the committee as they retreat to do the final report that they will consider human resources for health specifically for the health sector. We know the amendments will cover different sectors, but for the health sector, a Health Service Commission to manage human resources for health is essential. And we'd like to thank the government equally for listening to our plea and directing that NHIF extends its functions and operations to provide health insurance for all public servants across the 2 levels of government. This was done through the Gazette notice by the CS Treasury, and we also thank the CS Health for taking it upon himself to ensure that NHIF comprehensive civil servant scheme is extended to all public healthcare workers across the 2 levels of government, and including even our retired civil servants. And so, with that directive, we urge that all county governments implement the Article 6 of the Collective Bargaining Agreement 2017 to 2021 on health insurance. It is the best cover for public servants, and we do not want instances where we've seen counties contracting private insurance that has inferior terms to the healthcare workers.
Na bila shaka mtazamaji, hizo ni picha za moja kwa moja ambapo matabibu humu nchini wamekuwa kilalamikia swala la matakwa yao kutokuwajibikiwa na serikali, na hivyo basi hapo hivyo wanazungumza moja kwa moja kuhusiana na jinsi gani watakavyokabiliana na maambukizi ya virusi vya corona. Aidha vile vile wameipongeza serikali kwa hatua ambayo imechukua katika kukabiliana na maambukizi ya virusi vya corona. Tukiachana na hayo mtazamaji, taarifa hiyo tutaendelea kufuatilia kwa undani zaidi. Jaji Mkuu David Kenani Maraga anatarajiwa kuhutubia wanahabari. Masuala yanayotarajiwa kuangaziwa ni pamoja na agizo la mamlaka ya rais na naibu wake, jinsi idara ya mahakama inavyopambana na ugonjwa wa COVID-19, na pia jinsi kesi zinavyoendeshwa wakati huu mgumu wa virusi vya corona, miongoni mwa masuala mengine. Kwa sasa wacha tuvuke moja kwa moja na tusikie kile ambacho David Maraga anazungumzia kuhusiana na jinsi gani shughuli za mahakama zinavyoendeshwa humu nchini, haswa katika msimu huu wa maambukizi ya virusi vya corona.
In this period of pandemic, it is important that Kenyans understand that even as the courts begin to upscale operations to include in-person operations, they will find extremely congested court diaries and dockets. The backlog of cases has built up quite aggressively since March 15th this year. Fellow Kenyans, the numbers of cases pending before our courts and the number of judges we have in our superior courts make for a grim reality for those of you who will be filing cases before our courts, especially in Nairobi, in the coming days. If you file a land case in the Environment and Land Court at Milimani, Nairobi today, the earliest your case will be heard is in 2022. This is because we have a total of 31 ELC judges in the country against a case backlog of 16,457 as at 31st of March this year. The situation is probably worse at the Court of Appeal, which has only 15 judges serving the whole republic, with a caseload of 7,315 as at 31st of March this year also. The situation is not any better at the Employment and Land Relations Court. At the Employment and Labor Relations Court, which has only 12 judges throughout the Republic, against a case load of 13,197 as at 31st of March. It is important to clearly and categorically state that this shortage of judges and the near paralysis of court operations has been caused by the President's refusal to swear in the 41 judges recommended by the Judicial Service Commission in July 2019 for appointment to the Court of Appeal, the Environment and Land Court, and the Employment and Labor Relations Court. The President has persisted in this refusal despite orders in 2 cases requiring him to swear those judges within 14 days. In the cases, petition number 427 of 2019 and petition number 369 of 2019, the President argued through the Attorney General that he refused to swear in the nominated judges because he had information that some of them have integrity issues. He claimed that he was actively consulting with relevant state organs with a view to taking appropriate legal and administrative action, including a review of the JSC recommendations. The 2 courts rejected those arguments and held that the JSC's decision recommending persons for appointment by the President as judges is not subject to review, reconsideration, or a second guessing by the President. Once the JSC makes recommendations, the President has no option but to formalize the appointments. The court ruled that the President